coming up, we'll be on location at the Shakthi Health and Wellness Center in Mount Airy, Maryland, discussing the latest advances in anti-aging and wellness and how they can help us maximize our health and look years younger with one of this region's top doctors, Dr. Jyothi Rao. Dr. Rao received her medical degree from the New Jersey Medical School and completed her residency from New England Medical Center. She also completed her fellowship from the prestigious A4M organization. Dr. Rao is board certified in both internal medicine and anti-aging and is widely recognized as one of this region's top docs. Welcome, Dr. Rao.
Thank you. It's great to be here.
Oh, it's our pleasure to have you on our program. It's your first time, in fact, on our Top Doctors Medical Interviews. We have a lot to talk about with you. We've got patients coming up as well. But there have been recent advances, Dr. Rao, in anti-aging and wellness that can improve our overall health and well-being. And I wanted to begin, if I may, by asking you if you can please tell us what some of these advances are and how we can benefit from them.
Sure. First, I want to just set aside the term anti-aging. We're not against aging. We want to age gracefully. So part of it is kind of looking at the stress reduction techniques, nutrients, hormone balance, things that will affect the way our cells age. So when we look at these kind of things, we can make huge interventions by allowing patients access to information where they feel empowered to take on these new ways of living, kind of a therapeutic lifestyle, which will allow them to get their cellular health in a better place.
Now, can you tell us about your anti-aging and wellness programs that you
Sure.
have? Because they've really developed and achieved a lot of acclaim already, helping so many folks.
Sure. Every patient that walks in the door for me, we get something called a heart rate variability test, which looks at the way our body deals with stress. And because I feel like stress is a big player in most medical illnesses and our vitality. So the second test that everyone gets is a body composition. I want to know what patients' fat percentage is and allow them to get the tools to kind of change that fat into muscle, which we're all struggling with as we get older. That ratio starts to go in an unfavorable direction just because we're getting older. But there's a lot we can do about it. And the third thing that we do is called a digital pulse analysis, which looks at inflammation in our blood vessels, which again, everyone's worried about heart disease, and that's one of the premier ways to kind of look at inflammation before it gets to be a problem.
What types of health problems can be addressed through all this?
We have a whole range of patients that walk in. We have everyone from the wellness check. I just want to make sure that I'm doing everything right. There's genetic predisposition in my family. What I want to teach people is that genes are not our destiny. We have a lot of control over the way our genes are expressed. We know this from recent science that our genes are not our destiny, and we are going to be able to manipulate them by the lifestyle changes that we do, whether it's taking certain vitamins, whether it's changing the way we eat our fruits and vegetables, or adding some spices into our cooking, getting more sleep, adding exercise to our regimens. These are all ways that we can affect our genes.
You're absolutely right, Dr. Rao. They think, look, this is who I am. These are my genes.
Right.
How can I alter or change them? I'm kind of stuck, so to speak. And that's not the case.
That's not the case, and it's a total different paradigm shift for medical practitioners as well. I think that it is something that empowers us, and I want to take advantage of not only being someone's internist, but I also want to be a therapeutic lifestyle coach for them. So I'd like to get them motivated to try to take on things that maybe they feel uncomfortable with: yoga, meditation, breathing techniques, which are so valuable, and promote sleep and restorativeness, and also work on stress reduction so that they can age more gracefully and they can age. We all will get older. Chronological age is not stoppable, but the point is to try to do it in a way that's graceful and that we can enjoy our quality of living.
And I would think from what you just told us that pretty much the vast majority of the folks watching right now would be a good candidate who could
That's what I'm
benefit
saying.
from this.
Anybody can
Pretty
take
much
advantage of this.
everyone.
We have elite athletes. We have people who just want to get their sleep under control. We have chronic medical illnesses we're taking care of. So anyone is a candidate for this type of intervention in medical care.
And what would you say, Dr. Rao, would be some of the health benefits of this and these programs and treatment options that you have, as opposed to the more traditional options that people are more familiar with?
So the one big advantage I find is that medication side effects, we go over nutrient imbalances for medications. And the other advantage that I think is a big one is that each medicine can only do one thing. For example, if you have high blood pressure, high cholesterol, and diabetes, that's at least 3 different medications. However, a therapeutic lifestyle intervention can affect all of those things by one intervention, which is changing the way we eat or our sleep patterns or our exercise patterns. So it has the ability to affect many, many, many different aspects of our life as opposed to pigeonholing it into one diagnosis in one category.
Yes, without the dependency on medication
Correct.
as well,
Correct.
which gets eliminated. And you know, that's something that affects people in a whole different area.
Right, and if we're looking at saving costs, well, for the patients as well as for our healthcare system, we have to start looking at prevention, and prevention starts with what we put in our mouths.
Yes.
So it's not just about colonoscopies and mammograms and prostate exams. It goes way beyond that into our lifestyle, everyday living, and what we can do, the simple things we can do to kind of age and have a better quality of life.
And how can this slow or even reverse the aging process?
What we do know is that certain nutrients and certain hormones and certain nutrients that we get from supplements or foods can actually slow down the aging process. And so we can actually get a benefit that's going to make our cells healthier. And if you make your cells healthier, then genetically you can, there's a telomere test that's out there that kind of looks at how even our chronological age is this, how are we genetically speaking, you can tell how old you are based on that. So it kind of gives us a gauge for how people are aging. So these are kind of unique tests, and I'm not saying everybody needs them, but it's a way to kind of quantify that aging process for certain individuals. I believe that most of the time we should get anything we can from foods and vegetables and fruits and those kind of things, but we can get aided by supplements and treatments like acupuncture, Reiki, massage. These are very relaxation. So stress reduction and sleep promotion is anti-aging.
Yes.
So we all know how bad we feel after a poor night's sleep, but imagine years or decades of that. It will definitely age people much faster.
No, you're absolutely right. And an example is, you know how we hear that phrase, he or she is a young 50
Right.
or an old 40.
Right.
It really depends. It's not the age, it's not the number.
Right.
It's what we are within ourselves.
Right. So it's our attitude, but also our physical well-being. And what I don't want to do is wait for things to break down. I think we treat sometimes our cars better than we treat our bodies. We want to make sure that the maintenance checks are there for our bodies as well.
Yes.
We don't want to wait till it breaks down. So that's the whole focus of Shakthi Health and Wellness. And what I want to do is also offer people time, because that's the other difference in the traditional model. I find that you don't have enough time to be able to discuss lifestyle changes for people. And I believe there's no cookbook approach. I think everyone is an individual and it needs to be personalized. And we have also several ancillary healthcare providers that we utilize to also aid in that whole partnership we have with the patient.
And what kind of results can we expect from the different programs and plans that you have here?
One of the things is we use markers, blood markers, to watch traditional things like lipids and cholesterol and sugar and inflammatory markers. The other concept, we do something called an MSQ, which is a medical questionnaire where it looks at kind of just your quality of life. It's hard to kind of put a number on it, but this test kind of puts a number on the fact that how well you're doing in multiple aspects of your life. And we see that number going lower is better. So the people who come in for follow-ups within 6 to 8 weeks or 3 months, we see their quality of life. For example, I have more energy. I never thought I was going to be able to, enjoy time with my children. On the weekends, I have the energy to go out now. I have, my hair's growing back. It's subtle things, for small things, but it's big for the person. And so whatever that is, that's why Optimize Your Vitality is our slogan, because everybody's vision of what their vitality should be is different, and whatever their goals are is our goals. So at the back end, we're looking at, as an internist, I'm looking for cardiovascular and cancer protection and all that, but then it comes to what the patient wants. If they just want more energy, I just want to be able to sleep better, I want to be able to enjoy my weekends, I want to get back on my bike. Those are the kind of goals that we work towards.
And it sounds, from what you've told us here, Doctor, it's a very customized approach that you utilize, very integrative. That's all about looking at each individual,
right,
and seeing where they are, and where they should be and where they want to be,
Right.
and helping them achieve those goals.
Right, and for that you need time.
Yes.
So when our first patient appointment is 90 minutes. So it sounds like a lot of time to be in a doctor's office, but by the time we actually get to the root of the problem, sometimes it takes that long, and then we develop a plan with the patient. And so follow-ups are also 45 minutes. So we don't have that 10-minute concept where you're in and out, which I think is problematic on both ends.
So you really get to know the patient,
Right.
and vice versa. It's
Yes.
not just you're in, like you said, and you're out. And how can you really customize an appropriate plan that's going to really yield the results that the patient wants or needs in 10 minutes, basically,
Right,
of
and
diagnosing them?
Our office is set up for the primary goal of good service for our patients. So every patient that comes in is known on a first name basis, and we all have the staff. It's kind of like you're going into someone's family. We're all, it's all kind of warm and welcoming, as opposed to kind of like a factory feel. So there's that comfort level that we want to instill, because what we want is that stress level to come down.
Yes.
We want to be able to communicate with the patients on a comfortable level where they're actually able to open up. And so we try to create an environment where that happens.
Well, speaking of that, we're now going to meet some patients of Dr. Rao. Welcome, Angela. It's a pleasure having you on our program.
Thank you. It's great to be here.
Well, we always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, Angela, by having you tell us what brought you here.
Sure. I've known Dr. Rao for a long time, actually. I first met her when I was pregnant and my daughter is 10. So I've kind of followed her around just simply because I like her approach, and it's done some good things for me.
So you've got quite a bit of history. You go back
We do.
20 years.
Yeah, we do.
So what are some of the treatments that you've had through Shakthi and Dr. Rao?
Sure. So mostly acupuncture, and it started with something as basic as carpal tunnel syndrome, and after a couple of treatments, it was gone. So then I guess you could say, converted. But then with Shakthi specifically, I've done the fitness testing and the LET treatment, and it's good stuff. It just sort of takes you to the next step of feeling better than you thought you could feel.
That's great. Using the integrative approach, which they obviously
Precisely.
utilize here. That's wonderful, Angela. And can you tell us as far as the results on the different treatments?
Sure. So, with acupuncture and the LET treatment, it's very much just a sense of, for me, fine-tuning and overall wellness, thinking about what doesn't feel good and how to fix it.
Now, for the viewers out there watching, Angela, what would you tell them about your experience, not only with Dr. Rao, which you've already touched on, but the staff here as well at Shakthi Health
Oh, it's
Wellness?
great. So I think they have a good social media presence, and I like that. It forces me to stay more engaged, and so it's not just about when I come here for an appointment, but I like them on Facebook. I get their newsletters and stuff. So you get little tips and tidbits that keep you thinking about optimizing your health. It's always easy dealing with front desk. I mean, very pleasant. Sometimes in doctor's offices that can be tricky. That's the front line of defense there. And it makes a really important impression, and they make a great impression here. So nothing to say but good things.
Well, on that note, I'd like to thank you, Angela, for coming down, sharing some of your experiences, and being a guest on our program.
Sure. Thanks for having me.
It's our pleasure.
It was fun.
Deborah, it's wonderful having you on our program. Welcome to the Top Doctors Interviews.
Well, thank you. Glad to be here.
All right, I wanted to begin by asking you what brought you here. What problem or problems were you experiencing that brought you to Shakthi Health and Wellness Center and Dr. Rao?
No, I have a lot of pain in my legs and a tremendous amount of fatigue. And this has been going on for years. Pain so severe in my legs that it's hard to walk, and fatigue that just hard to do things. I've tried the traditional routes. For the pain, the doctors always want to give a pill, a pain medicine pill. The problem is that caused enough problems for me to be fatigued. It's treating the whole system.
Yeah, it's like a Band-Aid to help to basically mask one symptom, which is the pain. But what most people that I still get amazed of don't understand out there, and I'm not taking a shot at other practices or doctors, but they don't realize that a lot of times that causes the other problems then.
Well, you're right. The pill is masking. It's trying to mask the pain.
Yes.
But then that's making me tired,
Yes,
and
which
I
is
don't have the
affecting your
energy.
life.
So, I came here, and I have to tell you, I've never, when I think of medicine, I tend to think of traditional medicine. You go to a doctor,
Yes.
they treat you, they do the test, they give you a pill. So coming here, I have to say that I wasn't your typical patient saying, I'm a believer in all of this. You know, what is this? It's not a magic pill to make you better, which of course hadn't worked for me. And the doctors here at Shakthi, they seem to take a lot of time, or they take a lot of time trying to get the whole of the person. So when I presented a symptom, they said, we'll take that information, but there may be other issues that aren't just a presenting issue. There may be things underlying it.
Yeah, or related that you're not aware of.
That's right.
And that's where the integrative approach that they utilize
Right.
here really is beneficial.
That's right. So to integrating everything, so it's, all right, we hear your presenting problem, but let's check the whole body out and take the whole system together.
Yes.
And so,
So you had that done when you came here?
I did.
And what did they find, or what happened?
Well, what they found is in doing the testing, of course, I thought, oh, they're going to do blood work. And this, they did a more extensive blood work and found out that I was low in important vitamins and nutrients in my body, that for whatever reason, my body's not utilizing them the correct way. They found out that some of the medicine that I was on from traditional doctors was not, I didn't need it anymore. So they've done a couple different treatments to me. They've done an IV therapy. And the IV therapy is what I call, I think they're mega doses of vitamins, but it's interesting. It took my system a long time to get up to where it should be for normal. So now I'm not coming back every week, I'm coming back periodically. And I could not walk from my house down to the end of the block. I was that fatigued. You know, I mean, I went to work, I did my job, but to walk, it was unpleasant. The pain in my legs was huge. The fatigue was tremendous, and then you get frustrated because you can't do things with your kids, and
So it's really affecting your life, Deborah.
it
Right.
affected my life terribly.
So you have these IV treatments done on a regular basis, and how's your life now?
Well, my life is much better now because, hey, I can walk the dog down to the end of the street. But I'm able to participate with my kids and things without thinking, okay, I'm going to get in the car, I'm going to drive them to some sporting event. I feel that my life has been turned around here, and I find that I never thought that I would be saying, let me believe in integrative medicine. You know, it's not the approach that I thought of. And in fact, I appreciate the doctors here because they'll give me the science behind it. And so with the science behind it, I know it's not just, oh, let's try this. Here's the science, here are the results. The paper they gave me, I bet it was like 25 pages of a complete printout of here's where you stand, here's what we're going to do, and here's how we'll follow it.
So a total, comprehensive, customized plan
To me,
for
customized
you.
to me.
That's just for you.
Yeah.
That's what we have found is that Shakthi Health and Wellness Center, with their integrative approach, really customizes a plan for each and every patient to fit your needs, and obviously a treatment plan that gets the result that you're all looking for.
I'm going to be custom to me because whatever are my health issues.
Yes.
And the other thing that the Shakti tells me is that it's not about just saying let's make you better, but let's keep you well. And so the wellness part, again, that was a new concept to me. It was, I'm coming in here for pain, but then they're saying the wellness is what we want to focus on, and keeping you well. And here are some things maybe you're not thinking about, which of course I could only focus on the pain and fatigue
Yes.
early on. So I'm now not coming as a sick patient to a doctor, but I'm coming as a part of wellness.
Now, lastly, before we let you go, for the folks out there watching, Deborah, any final thoughts that you'd like to let them know about Dr. Rao and Shakthi Health and Wellness Center?
I'm so thankful that I found them. It wasn't a path that I thought I would traditionally go on, but it is the complete package towards wellness. Is really where it should be for all of us. Not just thinking we go to a doctor for a problem, but how do we prevent problems? And I now have become a believer because of what it's done for me.
Well, that says it all. And on that note, Deborah, thank you for joining us, sharing your experiences and thoughts, and being a guest on our program. It was our pleasure having you on.
Thanks.
Welcome, Luann. It's wonderful having you on our program as well.
Great, it's great to be here.
Now, I wanted to begin by asking you, Luann, how long you've been a patient of Shakthi Health and Wellness Center?
I've been a patient for about 6 months.
Okay. And what brought you here?
Well, I think it was all stress related.
Okay.
I've had various issues, and Dr. Rao was very kind and patient with me and worked through a lot of my issues, and such as working with acupuncture and the IVs that they offer here.
Yeah, so you've had these treatments.
Mm-hmm.
This was, I take it, when you met with her initially, they customized a plan for you.
Well, they customized a plan. They did an extensive background on my history and kind of supplements and, you know, nutrition and that type of thing that I've gone through. And actually they've compounded a lot of my supplements that I'm taking, which has made my life easier. So just have been kind of progressively working towards a goal, and I think I'm close to getting there.
Well, that's wonderful. Very happy to hear that.
Thank you.
And for the folks out there watching, what would you tell them as far as how your experience has been with Dr. Rao and the staff?
The staff here and Dr. Rao are very patient, very caring. I'd have to say I've been to a couple other places, and they take the time to understand and listen, so their level of compassion is off the charts. I've had a great experience. I've referred many people to them, so I'm very pleased.
Well, on that note, I'd like to thank you very much, Luann, for joining us, sharing some of your experiences, and being a guest on our program.
All right, thank you.
It was our pleasure. We're now back with Dr. Rao. I must say that not only are you changing lives, but you're really, these people are getting their quality of lives back that they had lost prior to coming here. They love you, Dr. Rao.
No, thank you.
They really do.
It's a pleasure to work with these patients.
Well, it
also
says it all right there. I'm telling you, what we just heard from these patients speaks volumes.
Thank you.
It really does. And now we're literally out of time, and I wanted to ask you, before I let you go, Doctor, you and your practice, Shakthi Health and Wellness Center here in Mount Airy, Maryland, certainly established a reputation for excellence, not only in patient care, but in anti-aging, wellness. You really use an integrative approach that is yielding outstanding results for so many folks. I just wanted to ask you what you feel helps separate you all from the others.
So our primary goal opening up the practice has been to separate ourselves by offering patients a safe environment where they feel relaxed, where they actually enjoy coming to, and also to have the ability to spend the time, the quality and time that we need per individual patient. We are accessible by email as well as phone calls. We try to get back to everyone right away because I know how frustrating it is to not be able to access your doctor. We have state-of-the-art equipment. We have diagnostic tests that are very unique to our practice, looking at gut health and hormone balance and neurotransmitter health, which traditional offices often don't allow for. We have access to specialty labs within the field of cardiology, looking at expanded lipid panels, looking at the endopat, which is a test that looks at cardiovascular health before the problem starts, endothelial function. And so we have lots of ways to get at prevention. So if I could pick one thing, it's being preventive on a totally different scale than anyone's ever heard of, because we look at these risk factors starting with endothelial function, inflammatory markers, oxidative function. So those are things that can affect people broadly in an adverse way when they go awry. So what we want to do is try to get to those things very early on and teach people the tools they have, the power they have to kind of control what happens in their body. I think people feel out of control. And so a lot of our time is done in education.
On that note, I'd like to thank you, Dr. Rao, for joining us, being a guest on our program. We'd love to have you back on in the future.
Thank you. Okay.
Thank you.